All right, my name is Deborah Tuff. I'm Gwinnett County spokeswoman. That was the start of a campaign that the county is doing to tackle fentanyl. It was to get the conversation started. What you may or may not know is that Gwinnett County leads the state in deaths. Let that sink in. Gwinnett County leads the state of Georgia in fentanyl-related deaths. And as Chairwoman Hendricks has said, one death is too many. It's ripping our families apart. It's ripping our communities apart. It is owing a huge debt to our society because you have grieving families who don't understand why or how their family members have become victims. So when District 3 Commissioner Jasper Watkins approached me, he said, Deb, we've had the conversation. Now it's time to put those boots on the ground, roll our sleeves up, and take action. And that's what this panel is about. It's about the county now taking action, and we're going to get into that. But before we do, let me introduce our panelists, and then on the second row, our subject matter experts. If you all could just raise your hand so people know who they can direct questions to later on. So we have Commissioner Jasper Watkins III, who is hosting and moderating the panel. On the panel, we have Major Chris Marion from our Gwinnett Police Department. We have Tasha Edwards, an advocate and a mom whose daughter became a victim of fentanyl. We have Amanda Moliterno with Viewpoint Health. We have District Attorney Patsy Austin Gatson, who was doing some landmark things here within Gwinnett County that the state is actually following. On the second row, we have subject matter experts Michelle Vereen with our Child Advocacy and Juvenile Services Department. We have Amira Abdul-Fadid, and I think I just butchered your name. Abdul Hafid, thank you, with GUIDE. We have community advocate Stephanie Morrison. We have Andre Castro, outreach director for GNR Health. We have Mr. Tom Branch with GNR Health and is the moderator of a lot of organizations here within the county tackling fentanyl. And then we have the Gwinnett Medical Examiner's Office as well. So we have a wealth of knowledge in here to not only talk about this crisis, but how are we going to get those boots on the ground? How are we going to roll those sleeves up? And these are the folks who can answer that question. They will be available to ask questions or to answer questions, receive feedback during the course of this panel. We also have some resource tables that you all can glean from if you haven't already after this panel starts. So before we get started, we're going to show you Fighting Fentanyl, Brianna's story, the story that kicked off this conversation. And then from there, Commissioner Jasper Watkins will moderate the discussion. Thank you.
Welcome to Upfront Gwinnett. I'm Deborah Tuff. For more than a year, we've researched the fentanyl crisis in Gwinnett County and the fight to stop it. Leaders admit that it is a challenge, one that's caused sleepless nights and a lot of tears for Gwinnett County families, specifically Mom Tasha Edwards.
Here's Brianna's story.
It was just the four of us. We were a very close-knit family. Out of my three children, Brianna was my most loving child, even though at one point she was the one that gave me the most hell. Oh yeah, so this is my niece. Mm-hmm. So me and my sister, we both had our children together. Mm-hmm. They're actually like 1 month apart. Wow. And then at the time when they were born, she and I actually lived together. So it was like, raising twins. Yeah. And they were really close growing up as well. I just have so many memories. Her voice.
But Brianna's voice of laughter, of calls to check in with her mom, Tasha Edwards, and siblings, a singing voice that could rival the angels, is now a memory.
I miss that she would sing, like she singed all the time. So it was nothing for me to wake up in the morning and hear her over in her room singing. Yeah, it's a lot. I miss everything.
It was Memorial Day weekend 2020. Brianna, or Anna as her family calls her, had just gotten her diploma and gone to a party in DeKalb with new friends. The night before, Edwards was admitted into the hospital.
So I didn't get a call.
Or text in the family group chat.
Everyone was checking on me, except for Brianna, which is highly unlikely because she was the one that always looked out for me. So go home, wake up about 1, 2 that next day, realize Brianna still hadn't responded. So at that point, I'm getting worried because it's just not like her. So I reach out to my other children, ask them, hey, have anybody heard from, your sister today? No one had.
Then her oldest daughter began scouring social media.
She had just started hanging with this girl, and she had went to her social media, and on her social media, she made a post saying, oh my God, I lost my best friend last night. And it was a picture of her and my daughter. She went to this house party, and she was given a Percocet, which was laced with fentanyl, and that is how she passed away. And she didn't even consume an entire pill. I'm sorry.
Even though Brianna attended a party in DeKalb, Gwinnett County Chairwoman Nicola of Hendrickson says in Gwinnett, the fentanyl crisis is no different.
You see, oh, this person died from fentanyl use, they must be a drug addict. Do you think that there's sometimes a stigma associated with these victims because that's what they are?
My heart breaks for that mother whose child is no longer here because of a mistake or because of taking something that she trusted was not going to have the outcome that it did. And unfortunately, everyone's lives are now changed. When I see the numbers of overdoses and deaths attributed to fentanyl, it's a big problem here in Gwinnett County.
We service youth from ages 13 to 17.
A problem Michelle Vereen knows all too well. She heads up Gwinnett's Child Advocacy and Juvenile Services Department.
Oh, there's absolutely a fentanyl problem in Gwinnett County. There is a nationwide fentanyl crisis. Youth who are experimenting with things that they think are opioids, but are laced with fentanyl. And so that is leading to some catastrophic outcomes.
I'm a social worker. A lot of my history has worked with youth, and youth are typically engaged in risky behavior. But in some cases, there are youth that are not engaging in risky behavior, and they think that they are in safe environments. And as a social worker, as a policymaker, as a mother, it really is on all of us to educate our youth, educate our communities on the dangers of taking things that you don't know is in it. One death is too many.
Data shows that fentanyl-related deaths have spiked over the last decade in our county and country.
It's heartbreaking. It really is. And then a lot of people feel like when this happens, it's happening to bad kids, to troubled kids, or to kids that are addicts. To my knowledge, my daughter had never popped pills. I didn't know about fentanyl. I never heard of fentanyl until I read it on my daughter's death certificate. I just feel like it's my duty to let other people know, to make other moms aware, to let these kids know that they should not be out here popping pills. If your doctor didn't give it to you, don't take it.
So as you can see, it's a troubling trend and a deadly design. Drug dealers lacing their products, then killing their clients. On the next episode of Upfront Gwinnett, Fighting Fentanyl.
To abuse fentanyl is basically like playing Russian roulette.
Fentanyl is going to be in everything. Pretty much every narcotic that you're going to find on the street right now is going to be cut with fentanyl.
We go undercover with Gwinnett Police and into the Gwinnett County morgue. Until then, I'm Deborah Tuff. See you next time.
Good morning, everyone. Okay. I'm glad to see you all here this morning. I think this is a very important topic because it is something that is plaguing our nation, but we here in Gwinnett County, that highest county on the hill, sometimes we think and we hide, but it's here, folks, and it's embedded in our communities, And the more we talk it out, the more we bring it out into the light, I feel that the more we can do about it. And that's why we're here today. I felt after acknowledging and seeing the video and working with Deb and the communications department on this, I felt that it was more than just putting a video out. We have to start the community conversation. Every other, I would say, epidemic that we've had in this country, we always tend to do knee-jerk. We see it, and we just don't say enough about it. But when it comes to fentanyl and teen overdose, it's all too familiar through the headlines. I myself, I'm a father of 3 kids and a grandfather of 1 teenage grandson. And so I'm a public servant, but I'm also a pharmacist. So in the communities, I can almost see these things start happening when the individuals come to fill their prescriptions. You know, now I've used fentanyl the right way in inpatient pharmacy for pain management. But when I start seeing that opioid being abused when individuals come to the pharmacies to pick up the prescriptions, or I start to see grandson or granddaughter or daughter or friend trying to pick up the prescription for someone elderly, or that cancer patient that passes away and all of those pain meds still stay around the house, it becomes an issue because that then gets into the school system, it gets grounded up, and so it is a major problem. And the bigger problem to me is these IMF, illegally manufactured fentanyl. I tell people all the time, if you get it off the internet and it's not a prescription that you went and picked up from a store physically, an illicit drug I'm talking about, 99.9% of the time, it will be laced with fentanyl. And you may take it the first time and nothing happens. But it's when you give that to the friend saying it was all right with me, then it's a problem. So we're here today to continue the conversation and to enlighten ourselves about the complexities of fentanyl use, the crisis, and what are we doing here in Gwinnett County? Because believe it or not, behind the scenes, with all these great people you see up front and on the second row, we are doing something. We really are, but we do need your help. We just cannot do it alone. It takes a village. It takes a community, not just a few people. So I just want to say thank you to everybody that's here today. Thank you all who are coming, and I hope that you take this series because we're going to transition from the drug, how it's used, what its effects are in the brain, what's the criminal aspect of it, and then later, in the later part of the summer, then we're going to talk about the behavioral aspect of why did you become addicted, and then we're going to transition into recovery and sustainability from recovery. See, it's you have to do it all together. You just can't start with the recovery piece and then expect not to know about the drug piece. So that's what we look for today. When we leave here today, it will be a call of action. It will not be a meeting to meet to have another meeting on about the meeting we had. It's going to be what did you do and what were your outcomes? And then as a county, how can we help you? In my mind, in Gwinnett County, the thing I'm going to push is Narcan should not be in your car right now. It should not be in every school, but it should be in every store, in every restaurant, and anytime there's an activity, someone should have on hand a number of boxes of Narcan. And we also, thank you, and we also need fentanyl test strips. We need to start training our parents, your friends, how to use fentanyl test strips. Because I've been places in my consultations where people have used Narcan where they've been in parties, and the friend will give the other person the Narcan and say, I'm finna take this, and you hold my Narcan, and so if something happens to me, you can hit me with this. Well, you know it's 2 doses in there. You hit them with it once, and trust me, folks, you can't go wrong giving Narcan. It's only kind of one way to give it. You do it the first time and do it your second time, but then with fentanyl, that's a bugger. Sometimes if it is that, it takes more, and you need emergency help after that. So, if you don't have your Narcan, it's just like your EpiPen. You should have it with you, and your car's not going to get hot enough to mess with it. I carry it in my vehicles and sometimes on my person when I go to larger events because of that fact. So, with that, I would like to push this over to the panelists, and I'd like to ask, from your perspectives, can you describe the current state of the fentanyl crisis in Gwinnett County?
I can start. So the police department, obviously, we see it firsthand on basically a daily basis. Officers respond to overdoses along with the fire department, and each of our officers are provided with Narcan. So if they beat the fire department to the location, they're able to provide that life-saving drug to the victim, so that's a big part. But again, we see it on a daily basis. I'm the major over the special investigations section, which includes the narcotics unit. And so again, we're on the first line in this fight, trying to take the dealers off the street. Each one of the overdoses that occur, whether it's a fatal overdose or just an overdose where the victim survives, that gets assigned to an investigator. It's an overwhelming caseload for them, honestly. Priority kind of goes to the fatal ones, where we're going after those drug dealers to try to get them charged in coordination with that the victim that they could cause that death to. We're having more and more success in that as the investigators have become more well versed at it. Secondly, each of the officers on the road, we just recently created a resource card. It basically has a QR code that if they go to an overdose victim or somebody that they suspect of being a substance abuse user, they're able to provide that code to them where they can scan that, enter their information. We're teaching them to try to encourage them to go ahead and fill it out right then and there, and it provides them their information to resources where those resources can actually reach out to them. Because sometimes they're not ready at that moment to seek those resources, but that continuous follow-up, I think, is important. I think right now, I'm hoping that we're kind of at just past that peak of the epidemic, potentially. Last year, you saw the numbers, 172 deaths. I think that was in 2022 figures. 2023, I believe it was 192 or 193 deaths. This year, we're down 36%. As of yesterday, I updated my stats. We're down 36% year to date as far as overdoses compared to 2023. I think that's a big part of the public health, the education, the training, everything that's going with it, along with the officers at the police department pushing the fight against these dealers, holding them accountable, taking them off the street. So far this year, we've made 39 fentanyl-related arrests. That's up from 28 last year. All of last year was 28. We're already at 38 this year. 2020, we had four arrests. So again, and we're taking more off the street. So we're pressing the fight. Like I said, the 36% down from last year, I think that's substantial. I'm hoping, again, the fight's not over by any means, but I'm hoping we're maybe over that peak.
Definitely. Thank you. I would say that in Gwinnett County, our district attorney, Patty Austin-Gasson, is doing a superb job in keeping this county straight. I can say nothing but good things about what she's done, what she's doing, and even in the future where things are going to go. And I think it's much needed that we have someone like her that's looking over us and making sure that our laws and what's being followed is strict, because there's nothing nice about when someone does this to your child or to anyone around you. And there needs to be consequences for this. And I think our DA and her office is doing, more than what other places. We lead the nation, we lead the Southeast region on this, and I think we're a county to be emulated. Yeah, we may have this issue, but it's the way we're attacking it and the way she's doing it. So I say, what trends have you observed in terms of usage, overdosed, and crime related?
Okay, speaking from a prosecutorial stance, Gwinnett County was the first county in the state of Georgia to start pursuing drug dealers for murder. And we got the first case here in Gwinnett County where it was a conviction for murder with a drug dealer. Because a lot of times people blame it on the user. And most times, a lot of folks don't even know what they're taking. So I tell young people and folks around, don't take anything, because those days of trying something once, try anything once, those days are over. If they try it once, they will die. So we have pursued those cases. We have several convictions based on that. And I was at a multicultural festival recently, and a young man came up to me and asked me why we were prosecuting drug dealers. And I said, because they're killing people. And if you know anybody that's a drug dealer, tell them to stay out of Gwinnett, because we will prosecute. Have a great day. That's how I approached him. So I thank our chairwoman. I thank our chairman here, folks, Deborah, what y'all are doing. And I thank all of these folks here, Tom Branch, all of y'all, that what y'all are doing, because it's all hands on deck. Thank you. We got to get that message across. We have to get it across. And just going into now, the middle schools, we did a youth summit, because I'm reaching out in all kinds of ways for prevention, for prosecution. We had a youth summit during spring break. And when you hear young people at that age saying that they want to give up, they can't go to the restrooms, people are vaping, so we're trying to fight it on all fronts and just keep working with our youth, never give up on them. And that's what I tell them, never give up. And now, the devil is a lie, but, he keeps coming up with more ways to kill our kids. There's another drug, xylazine, and it's like a horse tranquilizer that Narcan will not help them come out of, okay? So we have to be on the alert and constantly letting our young people know, you can't do this. And, we know that they're not really ready to make these choices because they're not finished. They're still being worked on. They're still becoming adults. And when things happen that they have to deal with for the rest of their lives, that parents have to bury their kids, it breaks my heart. It breaks all of our hearts. And we just got to keep getting the word out. We're working hard on it. And I'm glad to hear that the percentages are going down now. We got to keep working and stomp it in the ground.
Thank you. As you can see, we're taking this very seriously here in Gwinnett County. The way I feel about it, if you leave the window broke, what you're telling individuals who are involved in crime is that it's okay. They don't care. The same thing in your neighborhoods. If you keep the trash out in front of it, it's okay. They don't care. But if every time that window's broke, you fix it, every time that trash falls, you pick it up, crime and nefarious characters will not come by, because they know we see you. And that's the one thing, how they lurk. They lurk in the corners, they lurk in the shadows of not wanting to be seen. So when you bring attention to them, when you fix that, when you pick up that trash, when you tell that child no, when you see something that's not acting, they're not acting properly, you do something. And I think we're getting back to that in Gwinnett County. Say something to someone. So with that, Ms. Edwards, we want to thank you for your story of your daughter within our community. From your perspective, what is the underlying factors that contributes, do you think, to this fentanyl epidemic?
Thank you. It's really hard to say. I know back in 2020, when the epidemic, when COVID hit, there were a lot of changes in everyone's lives. And a lot of people feel like, maybe a lot of younger kids started using or doing things during that time. To be honest, I think it's just kids being kids and, wanting to experiment. It could be peer pressure, when they're out with their friends and, everybody else are doing certain things and they join in. It's just really hard to say.
I understand, no problem. But thank you. I know I sometimes when I'm at the counter and I'll see a parent come through with their child may be on the spectrum, and I'm noticing that the product is being used more than what it should be. First thing I ask is, do you have any more siblings in the home? And that's when I find that the other sibling is either breaking in half the product and then lacing it, or they're taking the child's product altogether. And it's easy to see because normally that parent will come with that child to the pharmacy, and I could just look at the child and just look at the action that there has not been a blood level established with this particular drug, that something else is going on. And then that's when I alert the parent. You need to start counting your pills. You need to start watching what's going on. If that child is eating too many gummy bears or too much ice cream or tend to be bewildered and changes the attitude toward you, maybe become a little hostile or listless, want to sleep all the time, want to buck authority, you got to question it. I know everybody thinks their child is the best. They will never do anything. I had 3. It don't work like that. There are times when timeout is truly, you got to separate and let them understand. So with that, from the viewpoint health perspective, do social issues like poverty, unemployment, mental health, and lack of access to treatment play a role in this epidemic?
Capital yes, YES. There's so many things that contribute to what's happening, and I appreciate being here today because I'm in the clinical, more reactive space, right? People have been using substances for many years. They come into our program to get treatment. So I think prevention is, like you said, prevention and treatment, they all need to work together, right? We can't be siloed with prevention over here, treatment over here, recovery over there. And when you were talking about, kids getting their hands on controlled substances, I was thinking about when I was in 7th grade, there was 2 boys who were in trouble for bringing OxyContin to school. And that was back when OxyContin was OxyContin. What's happening today is it's fentanyl, which is exponentially more dangerous than opioids, prescription opioids. That's what's happening. So kids are still being kids, but it's lethal. And kids have that part of the brain that needs to take risks. So back in the day when it would have been not as dangerous, it's a lot more dangerous today. So now we need to have that discussion about we need to be more preventative because it's not just we'll catch it next time. It is life or death that first time. So I work in medication-assisted treatment, which utilizes medications to help people who have substance use disorders, specifically opioid use disorder. So having these medications accessible, so if we even notice a start of use of opioids, getting people on these medications that could save their life. Being on a MAT medication decreases risk of overdose by 50%. So we need to work on destigmatizing things like Suboxone and methadone because these can keep people alive. And buprenorphine can be given to kids as young as 16. So if there is any use being known of a teenager, 16 or above, getting them on these medications can save their life. And that's a conversation I think we also have to have in more of the treatment space. In terms of prevention, I've done a harm reduction training. I talk about fentanyl testing. Drug testing is what it's called. And the chocolate chip cookie effect, which is, if you think about a chocolate chip cookie, you have the cookie part and you have the chocolate chips. And for example, a Percocet, there could be chocolate chips of the fentanyl in that Percocet. So if kids are going to use substances, which they have for ever ago, and they're going to continue using it because that's just what humans do. Can we have them test these substances before they use them so they're more aware of how they take them and that they can stay alive after it? So it's less of turning a blind eye to it and saying just don't do it, which again, we can do for prevention-wise, but if we want to take a harm reduction perspective, if you're gonna do it, how can you do it the safest way possible so you could stay alive? And that's the space I come from.
So as you can see, understanding the problem. Think about that for a moment. The federal government declared the opioid crisis a public health emergency back in 2017. As a start, though, Gwinnett County has dedicated more than $1 million to fighting the opioid crisis and to remove opioids off the street, to provide resources to identify various opioid prevention and treatment activities to prevent harm, to include, like I spoke earlier on, the use of Narcan and fentanyl test strips more readily in Gwinnett County, which we'll discuss a little more. So in understanding this, tell your kids, every dope dealer is gonna tell you, my stuff is clean. They're gonna tell you, my stuff is the best. That's when the problem starts. And no, we don't expect your child to have a test strip and put it in a bottle and test it right there on the spot. But the fact that they have access to that, and that if they did test it or brought it back to you, you understand how it's tested, and then that's when you go to law enforcement and to our DA's office, and you turn these people in anonymously. You have to, because the next person that comes in may be one of your loved ones. So transitioning from understanding the problem, we're gonna look at how it impacts the community. So I'm gonna come back to Viewpoint Health and Amanda. So how is the fentanyl crisis affecting the overall health and well-being of our great community?
Again, very much so. We're starting to see, I mean, we have clients from 18 to in their 60s, right? We are getting a lot more 19-year-olds, 20-year-olds, you know, using 50 fentanyl pills a day, right? This is where they're starting. And it's impacting not only them, but their family, their friends. Like, if you think about addiction, it's you throw a stone in a pond and there's ripple effects. So family, community, the micro and the macro of it all, friends at school, their teachers, everyone's impacted by this. The hospitals with overdoses, how many resources are being utilized to treat people coming in with overdoses, which they're human, they need to get the treatment, but if we could help decrease overdoses, that's gonna decrease the stress on the healthcare system and the emergency rooms and the crisis units, right? So it's not just the person who's using the substance, right? I was talking about this earlier. I've offered Narcan to certain people and they're like, I don't use opioids, or I don't know anyone who uses opioids. It's like, well, do you go to QT? Do you go to the grocery store? Do you go to concerts? Do you go outside of your house? Like, you could come across someone who's experiencing an overdose. So if everyone in the community can be like, well, I don't know anyone who does that, or I've never, you know, that's not part of my world. It is, because you live in Gwinnett County, so it is a part of your world. So if everyone could just band together and understand that it doesn't just impact the person using the substance, but everyone and everything around them, I think we would be able to make a lot of progress.
Thank you. And to a follow-up on that, from our district attorney, Ms. Patty Austin-Gaston, what specific challenges are our courts facing with this epidemic?
Well, we are prosecuting these cases. As I indicated earlier, we were the first jurisdiction to charge drug dealers with murder. And it is a challenge because a case recently that we got a conviction on, this drug dealer was making like $11,000 a month. And it's just it's luring people to this. And I'm suspecting that maybe they think they'll make some quick money and get out of it, but they're leaving carnage behind them. And this particular drug dealer, his girlfriend also overdosed and died. and then a young man overdosed and died, and he was the second child in the mother's family that had overdosed and died. So this is costing, it's a price that a community cannot afford. We can't afford this anymore. We got to get this word out to people. And now it's getting so pervasive that the drug dealers are online. So you can order the drugs and it can be brought to your home. They don't even have to go outside for it. It's so many different ways that it's being trafficked. And we have to be very cognizant of what's happening in our community. It's very imperative that we dig down families that have kids with social media, telephones. They have ways of getting this stuff. And it's bad because the drug dealers are looking at it, I think, they just want to get some hits. They just want to make some money. But we have to be a community that says it's not worth that price, you know? And I try to encourage our young people to get educated, to know that there are good ways to make money. And if they're smart enough to run a drug business, they can do something else, okay? They can definitely do something else. So we are just going to continue to fight the fight, and I'm hoping, as Gwinnett Police Department has said, that it's going down. We got to keep it going in the right direction. So let's continue fighting. We just have to fight. Don't give up, y'all. Just keep working hard. And I appreciate everybody that's involved in this. I mean, I've seen Tom Branch at churches. We show up together. I'm like, hey, how are you? And he's giving out Narcan, and we're talking to people. And we got to continue doing that, because Gwinnett County is a beautiful county, and we have the resources here. Thank you, Commissioner, for helping to provide that. And we got to keep going. We have to keep going, y'all, because we do the prosecution, we do the prevention, we do what you call harm reduction. You give them something else to replace what they're doing, so that they're alive. So all of it is valuable. All of this is very valuable because we want to keep our kids alive. I got 4 grandbabies that live in this county. I got 3 adult children that live in this county. So we're vested. I'm vested in this, and I'm going to keep fighting.
And from a law enforcement perspective, can you give us your take on the impact of the community?
Yeah, it's a huge impact. Again, the other crimes that it drives, but again, what all of you guys have already discussed, the ripple effect, the family. Narcotics investigators, you know, they typically, it was non-victim crimes that they were dealing with back in the day. They were going out and arresting drug dealers. We weren't targeting drug users. It's always people who are selling drugs, providing drugs to other people, causing harm to other people. But you weren't seeing the victims. Now, again, we're going out on every one of these overdose fatalities and meeting the families while they're grieving, following up with the families as the case progresses, and we're trying to follow up, get more evidence. I think it's having a toll on our investigators, quite frankly. Again, it's an extra caseload. And like I said, that was good news that it's down 36%, but it's because of this big effort that everybody, the community is putting forward. The police department's playing a small part in that, and I think it's an important part. But again, everybody's pushed towards this, and it's that we're not sticking our head in the sand, that we were fighting back and addressing it. I think if we let off, by any means, it's going to continue. The fentanyl's still out there. The drug traffickers are still bringing the drugs over the border from Mexico. One of the reasons I think Gwinnett County has been such a hot spot is that it has, for decades, it's been a hot spot for drug trafficking. The cartels, they bring the drugs over the Texas border. Metro Atlanta, specifically Gwinnett County, because it's on the north side of Gwinnett, or of Atlanta, has been a hub for drug trafficking for decades. It's a good spot because the interstate system, logistically, they then transport up the East Coast or up I-85 or up to the Midwest through I-75. The DEA is well familiar with that. We're partnering with them, so it's an important part of it.
to
From
get our subject
panelists.
matter expert.
Yes, so any of our panelists, please jump in. Again, we're asking a question about the impact on the community of this fentanyl crisis.
We see the impact at the family level. Sometimes what happens is a young adult will die of an overdose, and you leave little children behind. And so you have grandparents taking care of younger children who aren't prepared to take care of 3 and 4 and 5-year-olds. So that's the impact that we see on the child advocacy side.
So I work with juvenile court, and our office is kind of like a front line. So when we come into contact with families, they're usually in crisis. They're looking for help, and one of the things I think that is just critical is educating our parents. Just like Ms. Tasha said, she didn't know what fentanyl was until she saw it on the death certificate. We have parents that are coming in all the time in our lobby seeking help, and they have no idea what fentanyl is. So we kind of see it on the front end. Where parents are looking for help. So.
I work with GUIDE. We're a youth development and prevention agency, so we're all about the prevention, starting when they're young. And it's gotten to the point where we're seeing the impact where when I'm doing my suicide prevention trainings, I'm bringing in GNR Public Health or Navigate or other recovery agencies to do the Narcan training, because that's just, we're seeing the impact and we know what's needed. So I automatically include that as well, and we spend time in every single training talking about fentanyl, trying to just educate the community. So again, going back to just the education part, the awareness part, because you don't know if you don't know. And I think just that education piece and is powerful, but the impact is there.
So let me bring something home to you again. Just I want you to be mindful of this. It's 50 times stronger than heroin. It's 100 times more potent than morphine. Pain is real. When you go to surgery in the hospital, it's real. And does this drug help in a hospital setting controlled by professionals? Yes, that was the intent. But then it got loose and it got out. That dog got out and got in the streets. And let me tell you, he's out there and he's cheap, very cheap to make. And it's easy to distribute. It's one of the easier ones. It's easier than the weed, folks. And it's cheaper. And the perception is it makes you stay higher longer. No, you're knocked out because you don't know that you're knocked out. So that's the longer piece of it. And then there's the recovery piece of it that some people don't understand. When you see an individual that's out on the ground, the assumption is if you're in a medical setting or you know a little about, they're having a diabetic coma, they're in some type of asthma thing. No, that's why having that Narcan available, you won't hurt them if it's something else. If you're the only one on the scene, someone else should be notified. But if you see that, you're not MacGyver, you're not gonna make something different, you're not a doctor, but at least you can understand just looking at them. And you have that Narcan, give it to them. It's not gonna hurt them if it's not that. But you gotta let the EMS or the law enforcement know that you gave them a dose, a 4 milligram dose. Now they do make it in 10, and they have other delivery systems. But the standard is the nasal spray that you see. So with that, we've taken you through the problem. We've told you about the impact. Now let's talk about solutions and prevention, because like I promised you, We're not leaving here today just, this is a good talk. We really got to have a call to action. Everyone in this room is a part of something, some organization. And if drug abuse and fentanyl overdose is not on your agenda or not part of what you do, then shame on you. It has to be, because behavior is guided by these illicit drugs. So you can't say that you're dealing with behavior if you're not looking at the underlying physical cause, which is probably a substance. So for all of our panelists, are you all aware of the strategies that have been proven successful in addressing the fentanyl crisis in other communities? And if so, can you give us a quick or brief outline of some that you've seen?
I knew they'd eventually give me a microphone. One pill will kill. That's what I start with every time I talk in our community about what's going on with the fentanyl crisis. Commissioner Watkins, thank you for bringing this up. The one thing we need to do in our community is get more Narcan out there. I applied for a grant 3 years ago and received 9 vending machines. They're sitting in my warehouse collecting dust because I need help buying Narcan to put in these machines. These vending machines need to be at the emergency department, so when mom and dad go to pick their kids up that survive, they can see the Narcan and it's free. When our inmates leave the jail or their family members go visit them at the jail, they can get a free box of Narcan. That's what we need to be doing. We need to think about how we can transport people to recovery and treatment after they've overdosed. We've got to come up with a plan, and that's what part of our opioid abatement program that we're talking about now with the 5-member committee. That's what they'll do in Gwinnett County. But let me leave you with this. No matter what you talk about fighting the fentanyl crisis, no matter how much money you throw at the problem, if you don't save a life, it's not worth it.
So one thing I would like to see or would like to have some help implementing in Gwinnett County is, like I know back in the day we had the DARE program, and it seemed like the school system have gotten away from that. I traveled to Florida in March, and I spoke at 7 school assemblies. I spoke to over 3,000 children. And I just wish that Georgia or Gwinnett County was doing something like that. I'm not really quite sure, how we could make that happen, but I do like what Florida is doing. And I get invited back every year to go and speak to their high school kids. So maybe that's something we could, try to figure out how we could do here in Gwinnett County, is to get into the school systems and, talk to these children and let them know the dangers of fentanyl.
Okay, now we heard that. There's a call for action. We just heard it. We don't walk away from here not somebody addressing this. Somebody, anybody, nobody. Somebody's got to do it. But go ahead.
All right, so following up on that point, GUIDE has a prevention coalition called Prevention Action Collaborative of Gwinnett. Tom actually chairs our opioid and prescription drug abuse thing, and we are recommending the Board of Education in Gwinnett to do a Operation Prevention, correct, John? It is evidence-based, it is completely free, it is no cost. Parents can do it, school personnel can do it, and it has built-out curriculums, everything, so you can teach kids the dangers of fentanyl, of opioids, of any other substance there. And Miranda Raines from Recovery Connections, I believe she is here, she recently presented at the Board of Education meeting this past week, talking about the program, and as a coalition, we're sending letters to the board members, kind of recommending, because it's evidence-based, it's absolutely free, it's no cost. They don't have to create a curriculum, they don't have to create a facilitator's guide, it's all created from them, and it's from the Department of Drug Enforcement Agency of the federal government. So what I would suggest there is, if anybody in the community wants to back that up, join our coalition, join the fight. And then going back to the prevention part, because I'd be remiss in saying we have to find out what is the reason they're turning to these drugs, to the substances. We held a town hall in January, and my supervisor, Michael Davis, said it perfectly. We talk about prevention and we compare it to a river. People keep jumping in the river and we're rescuing them and we're pulling them out, but what is causing them to fall into the river? And that's what we need to fix. And when you look at the school surveys, 80, 90% of all middle school, high schoolers, and they don't do the survey in elementary school, they're stressed. And so they think taking a Percocet or a Xanax is gonna help. But they don't know where that medicine is coming from. So teaching those resiliency skills, those social emotional learning skills, the resiliency, building that up when they're young is gonna help them as they get older and help the community grow healthier and more productive.
Oh, and I agree with Amira. And I don't work at the adolescent or child level, but I do know I've working in this field for 6+ years. Is anyone familiar with the ACE study or the ACE questionnaire, Adverse Childhood Experiences? Each one that you have checked on that increases your risk of substance use disorder. I use that term. So understanding the link between childhood trauma and substance use disorders. So I don't know if they're implementing every kid in public schools to do the ACE study. I don't know how that would look, but I think identifying trauma, identifying mental health struggles, behavioral struggles, I mean, those are such big indicators of substance use and substance misuse that would be a huge place to start. I mean, at least 90% of our clients we see have suffered from some sort of trauma or abuse as kids. I mean, that's not a blanket statement, not everyone. I mean, there's other reasons, but that is such a big one. You can't ignore the fact that that is a big indicator. So I think identifying children in the school system who have home lives that they're struggling in, giving them a place to talk, having maybe some group action going on, and I know, Amira, you're doing all this, so I know it's happening. And working in MOUD, or medications for opioid use disorder, the stigma surrounding that, the stigma surrounding fentanyl in general, kids are afraid to talk about that they're doing it because they're gonna get in trouble or people are gonna look at them differently. I mean, the stigma is what's keeping people silent, and I think if we have more of an open, honest conversation and tell them it's okay to tell us that this is something you've done or something you're thinking about doing, like, let us have a open and honest conversation. So we just need to destigmatize substance use disorder. You know, I know there needs to be the action for the people dealing it, absolutely. But also being less punitive for people who struggle with substance use. You know, we have multiple clients in our program in drug court. They come in, they take the Suboxone, they really, really want to get better. And they really want to do the right thing, you know. And Gwinnett, Newton, Rockdale, we have people in each county's drug court on Suboxone. So we are seeing a lot more acceptance of it and understanding that it saves lives. And I could do a whole thing about stigma surrounding it, but I can save that for another day. But harm reduction also, I don't know how parents would feel if people went into the schools and taught people how to test their drugs. Again, those are the things that we have to not fight, but have conversations about. But that would be something that they'd be like, oh my gosh, like they're telling us if we're going to do this, that we can do this. Like that I think would open doors. And the misunderstanding that harm reduction is like, okay, go ahead and, it's saying it's okay, or it's saying to go use drugs. That's not what harm reduction is. It's like sex and abstinence. You teach kids not to have sex till they're married. Kids are still gonna have intercourse before they're married. So let's educate them on how to do it in a safer way, and we could keep our kids alive. I really think we need to have more of a talk about being more transparent and honest with them.
Okay. Now, we've at a high level with all of our experts here, we've got a little bit of understanding of the problem, the lethality of the drug. We've seen the impact on the community and talked about some of the solutions and preventions. But now with Deborah, we're going to open up the conversation to you, to give you an opportunity to ask the best of the best some of the questions that may be on your mind, or something that you may want to take back to your organization, or something that you just may want to know. I think this is that time where you have the brain trust, as they say here, that could field your question. And you know, as they say all the time, there is no weird question. The only weird question is the one you don't ask. There's one right there.
Thank you very much. I'm Barry Henson. I'm the Executive Director at Recovery Connections. And Commissioner Watkins, we just really appreciate you spotlighting this and having this town hall. This is a fantastic conversation. One of the things that I've got a question for the district attorney, and thank you. I too believe that if you're supplying our children and people with fentanyl, that you need to be prosecuted. We, on the other side of that coin, are seeing the users and the folks that are affected by that use. Georgia has with the exception of Texas, has the greatest number of trained certified peer specialists in addiction than any other state in the country. It's an army of people with shared experience ready to do the hard work on the ground. My question to you would be, from a prosecutorial standpoint, is there consideration in play now to connect that peer workforce to those who are suffering from substance use disorder, so that we can get them the help that they need?
Yes, I totally agree with that. Let's get help to people that need it. And we are still reaching out. We do have a outreach part of the DA's office. We have gone into Berkmar. I'm on a team with Berkmar, having talked with folks there. We had several young people overdose there, and now they do have Narcan on the campus to help out. You know, luckily those teens did survive, but talking with them at the school, they talk about how they can't stop. I've heard people say they can't stop. So those are the things that we have to continuously work on. We do have our community resource guide that the district attorney's office has put out, and we're going to be growing that. It's going to get bigger and better. But initially, what I tell folks in my office is that we're always trying to direct people to help. We're always trying to do that. We're talking about victims. We're talking about the users also. So that's one thing that we do in the DA's office, is just try to direct people, because if we can keep a user from going down further, you know, we're there to help. We also, you know, of course, drug court, we do run that here in the county, and we do try to help people at every turn that we possibly can. It's not just about throwing the dealer in jail. It's about trying to get to the root of the problem. And I think that's what you're saying. We get to the root of the problem and we cut that off, and then we're all better off. But it's a long fight, and we can't give up. We just got to keep fighting.
Oh, yes, I'm sorry. I was like, yeah, so our program is very peer-focused. We have 2 peer recovery coaches. We are trying to get one out in Newton County as well, because we have 2 locations. I mean, they are the backbone of it, right? So traditionally in addiction treatment, it's clinicians or therapists, perhaps people who've never experienced addiction and just think they know it because they read articles about it. I myself am not a person in long-term recovery, and I tell, if clients ask, I'm transparent. I say, but it's very important that you have these peer connections, someone with lived experience, someone who you can identify with, who could share their story. I mean, that's what people connect with. And, some clients have said in the past, clinicians, they felt like there was something amiss, perhaps. They were maybe too clinical or too intervention-based, when peer coaching is just a space where they can be, and not that peers don't have clinical. I mean, motivational interviewing, they have to do continuous training. I mean, I feel like I could not work in another treatment program that doesn't have peers on the forefront. I think it's amazing, and the council is amazing about generating these, and they have a new MAT, specialized cares for people with medication-assisted treatment history, so it's really growing, and I think it's a very, very crucial thing to have, and if certain treatment programs have not adapted to it yet, I think they need to get some peers on board.
Good morning, everyone. My name is Katrina Fellows. I'm with Georgia State University and also an organization of Bear Initiative. So my question is to the individual with GUIDE, and as well as with law enforcement and also over at Viewpoint Health. Now, and I'm glad that you mentioned about some of the issues that have maybe been in the past with trauma. My thing is more leading towards the anxiety that children are facing now. And this is not a blanket statement, but there are a lot more children that are experiencing anxiety, and that effect and how it's getting them to move into that direction of trying to control that, but at the same time, not having the critical thought that maybe they may be needing from the school. And so to the law enforcement, I'm asking, are you experiencing or have you guys interacted with more of our youth that when you interact, there's some form of anxiety that you can see or behavioral issues that you can see that are stemming from anxiety? And this may be what's leading into them coping, because they also see parents or adults that not being able to deal with anxiety pop a pill. They hear it in their media, in their music, and it's in all languages that are talking about taking different concoctions that are created to address or to feel some way, alleviate something that they're dealing with.
Yeah, I definitely think the prevalence of, or the openness, awareness of anxiety in people is definitely heightened these days. Partly, again, I think maybe it is more prevalent, but I think also we're more aware of it. The department, we have 6 teams in the behavioral health unit teamed up with Viewpoint where it's an officer and a clinician riding together to respond to calls where somebody who is facing crisis or somebody who's experiencing anxiety, instead of a uniformed police officer handling that call, we try to divert that to an officer who's a little bit better trained, has the clinician with them, and is able to better handle that call. So I think it is something that we are facing and trying to address.
As far as thank you, I'm sorry. Do you have some form of measurement or metrics that you can understand the level from, trends, basically? Are you guys beginning to measure that, or is that in consideration, or could that be in consideration, a part of the plan to address what we're seeing, this epidemic that we're seeing?
Yeah, they're keeping stats as far as how many calls they respond to. I'm not sure. That's not my area, and so I'm not exactly sure, like, how detailed is it? Is it, are they measuring out the type of call, what they are facing on that? I'm not exactly sure what details that goes into, but it's...
I appreciate that question because I do work with our young people throughout the county. I've run 3 cohorts of our Junior DA Investigator Mentorship Program, and the children are different. They're just different. I mean, we had a lunch, with them, and you make sure they get their food, they get their lunch, and everything's so quiet. When I was growing up, you used to have to tell kids, quiet down, quiet down. These kids are not doing that. And I think part of it has a lot to do with social media, and everybody hears that. We hear it over and over. Social media is a problem. There are some schools that are restricting the cell phones from the school during the day, and I think we're going to have to start doing that, because if we don't, we're going to keep losing them. And when they come out of their shell, it takes a minute. It really takes a minute to get them to start talking to one another, to start interacting, because they're so accustomed, and it could be, partly from COVID, what they had to do, and, be, locked down. Now they're back in the school system, and we got all of these problems to the extent they can't go to the restroom. It's got to be timed. I had a middle schooler at our youth spring summit talk about he wanted to give up. He says, I just want to give up. And we can't allow our kids to go down that path. We got to fight. And I tell people all the time, if you know a young person, get to know. If you don't know one, get to know them. Talk to them, because they really need us. I've been in venues with kids, and I'll just tell them, I love y'all. I love you. And you'd be surprised the looks that come over those kids' faces. And we have to reach out. It's simple. To me, it's simple. We just got to reach out, talk to them, bring them into the fold. Each one teach one. We are a village and all of that. It's not just, flowery language. These are the things we have to do as a community. And nobody gets a pass. I don't care if you're bedridden, you don't get a pass. You reach out. You got to talk to our young people. We cannot give up. We got to fight. This is a fight. It's a fight for their future.
So, in regards to data, I don't have data about actual diagnoses, but we do, per my grant, and just for keep up on my knowledge, I do study the surveys. Gwinnett Schools does the Gwinnett Student Health Survey. We do the EKC as well. We have seen an increase in students reporting feeling anxiety or feeling anxious enough that it disrupts their day. So we have seen that increase. The new question on the survey this past school year was, how often do you feel stressed? And I alluded to that earlier when I was speaking, where you could not see a number below 85% between 6th grade to 12th grade. And going back to DA's point, I think the kids nowadays, they don't know how to talk face to face. You do have that social media, and they're always connected to a phone, which is great during quarantine because they could stay connected, but at the same time, it's taking away those social skills that you would learn, that we learned growing up. So they don't know how to talk. And they're young, they're kids. They don't have the skills or the language necessary to explain what they're going through, what they're feeling. But just to speak to your point about data, I have seen an increase for that. And going to the point, like even with my training, we do youth mental health first aid trainings, and I'm in the schools trying to do this training with teachers and anybody in the community. We just got done doing training 70 people, 60 of them school personnel with the training, where we talk about just trying to get them to talk. And social media has now a whole new section in that evidence-based training. They had to redo it just a couple of years ago to add social media to that. The Surgeon General has said there's a social media, like the epidemic of it, advisory of it. So I think having that disconnect, there's pros and cons to it, of course, but just having that time to disconnect and having that conversation.
All right, so my name is Balisa Perkins. I am the coordinator for Family Treatment Court, and I just wanted you guys to know that Family Treatment Court is an option. I know we heard drug court, but Family Treatment Court is also an option for individuals that's in jail, that have smaller kids, that are working, have a private dependency or a dependency case in juvenile court. So we are an option, we are a resource. We are big on strengthening the family and keeping the family whole and hitting that trauma So we are an option for adults that are battling drug issues. So I didn't have a question, but more of a letting the community know that we are an option, and we're based in juvenile court because, you know, it's smaller kids, but we work directly with the adults that's battling drug addiction. So I just wanted the commissioner and Ms. Patsy to know that we are an option other than drug court.
I told my friend I wasn't going to talk, but I guess I am. My name is Angela Woodruff. I've lived here in Gwinnett for about 20 years, but I've also worked for Gwinnett for 20 years. I work for Judge Warren Davis, who is one of our Drug Accountability Court judges. And I really there's not much I can say in the way of a question because I'm also the sibling of someone who died of fentanyl. My brother died in 2019, and he was 39. And Tasha and I connected that way, and it's just a difference because I'm listening to Viewpoint and listening about the Suboxone and listening about all these different things. We've struggled with that, you know, the stigma that comes with it. My mother is East African, so to try to get her to understand that, no, they're giving him this to help him, or no, you can't enable him in these certain ways. There's so many different dynamics that we fight as families who are trying to help those that are suffering longer addictions than the unfortunate one time that also can take your family member out. So I thank Viewpoint because you all were very critical in my last meetings with my brother. I had to go search for him in San Francisco because he was homeless, even though he had a family that was willing. I always tell people this is an illness. This is a sickness. I look at it the same way if somebody came up to me and said they had cancer. And I'm like, we got to help them, but you got to want the chemo. It's got to be you. And my last interaction with my brother, I actually watched him take a hit. He asked if I can take a hit before I go to the doctor or to the hospital. And he said, after he took that hit, he said, you don't understand this feeling. He said, I feel right now that God himself, I'm cold, but he himself put a sweater on me. And I just looked at him in that Uber and I was like, I can't even understand. The mind doesn't comprehend that feeling that he wants to keep reaching for. And then it just got too far. They gave him 6 hits of Narcan. They found him once, 6 hits of Narcan because of fentanyl. They got him back. It didn't wake him up. It didn't stop him because it had gone too far. So these resources that Gwinnett is giving us, that you all are providing, these people who are suffering, they truly are. And even, Madam DA, I appreciate you. You know, we work with your office closely, just knowing that there is options, there's ways. It's not just about us wanting to prosecute. Yes, prosecute those ones that are out there doing this to our youth that are taking our families away. But there's always like, hey, you have a way out. If this is a true addiction, we're going to put you in the drug court program. We're going to watch these people graduate. And those people that are graduating are the ones that will probably be your best resources to get in those schools. Because as much as I have 2 children, my kids, I have kept them busy. I have done everything I can because I don't want you to have any downtime. I can still miss. I know Tasha as a mom. She's a great mom. She was on her children. So there's always something you can miss. But to have the people who have gone through that, when they watch that story of Breonna's story, how can you not be affected? So it's not just us having these resources in place and us that have never suffered it. It's watching the people have gone through it and have come out and just give that story. And I'll say this, I really tell my brother's story and I really get down and dirty about it. And I say how horrible it was, what I watched, what I had to see when we buried him, what they did, what was coming out. It just the stench. And I sat my children and everybody in front of there and I said, you all understand. This is what happens. Look at him. This 39-year-old smart kid is gone. You have to face the reality. So I tell the stories. I thank you, Tasha, for telling your story. It's hard. But if we don't tell the stories, if we hide behind it because we're embarrassed, we're going to lose more. So in my community, what I try to do and what I want to be a part of even more is telling the story. I think it's critical and important. And then once you tell the stories, look at that line of people here who are ready to help. So I thank you, Gwinnett County. So.
You have a follow-up?
And thank you. So this is something very serious that we are saying we want to address in our communities and around the nation, around the world. And there's some things that I think that we also need to be recognize that every individual who is participating in drug use or addictions have to understand that there's some accountability, even
Your mic closer.
even to the individuals that are using. And if they start at an early age in behaviors, and this goes back to the young lady with Guide, I just kind of lost my train of thought of where I was going. It's if they're being shut down, children, when they're trying to communicate what they're needing, and they're being shut down at a school level, at home, everything is too much to even deal with our children. How is that impacting them? And we may not know, but that's an impact if we're shutting our children down from being able to communicate on what they're coping with, because they're not knowing how to cope, and the best way at that point becomes escaping. And that's just a statement, so there's not really a question.
I think you're right. And then from this, I'm not in the schools. I know that they're facing their own struggles, and they have their policies and their procedures, and they're understaffed, and they know that they're continuously hiring. So there's that barrier. And then you have single parents who have to work, or displaced families, or families with parents incarcerated, which adds to those adverse childhood experiences, the ACEs that Amanda was talking about earlier. And I've had that question. Actually, it was a question presented to me every time I'm out in the community, every time I'm doing a training, and I was like, 988. They have those peer specialists that was brought up for mental health, and they don't care who's on the other end. So if they're getting shut down at home, at school, wherever, they can easily just text 988 for free. We already know they have the phones. We talked about that. So they can text. And that's what resource I give, and say, hey, there's somebody out there that cares, that wants to hear, that wants to talk to you and get you the help. So that's what I do, personally.
So I can tell you here today, I'm going to make a commitment to you. Right now, I'm seeing so many silos of people doing fantastic things that the other hand knows nothing about. I'm going to create a conduit, a dashboard of sorts, where everyone in this room will be able to see what everyone else in this room is doing. And that a mother or a student that wants to see the prevalence of what goes on in Gwinnett County, deaths, how many prosecutions, how many recoveries, how many peer counselors, phone numbers. It needs to be one stop, one shop. Because if it's not, I in this room did not know about what you do. That could help you. That could then help you. And we talked about how much we do so good. But when we can't share it, it becomes just a bunch of do good. And I think that's why our military is so successful, because everybody works together. I mean, as a veteran, I need to even bring the veterans into this conversation. Because what people don't realize is a veteran that's home with PTSD has a family that has a substance abuse problem, because they're dealing with how to cope with him or her. And guess what? The only thing they can use to do it is a substance. And they're going to go with the substance that's the closest and the cheapest to them. So you have to basically take care of the whole family. But when you have organizations that just take care of one part of the family, then you leave another part out. So that family member has to have a place to come. So look forward to the future. In the coming months, I'm going to start reaching out to you all and establishing this platform where we could have this information gathered in one place. And why is this the so what in this? Is so that when we establish the opioid abatement community and start using the resources that's been given to us by the federal government, we will have a conduit where anyone in this country, anyone in federal government could come and look and see what Gwinnett County is doing. And then when they say there's more money available, they actually can put a finger on it and say, well, Gwinnett County is doing this with reverse, and they need more this, they need more beds, they need more buildings, they need more transportation. Why? Because our numbers are there. We can't be afraid of the numbers. We'll have on there individuals that you can contact to come and talk. Well, you don't have to go and search. Here are 8 or 9 people that are available to you to come and speak to you about, see, that's what we need. It's this guessing game and trying to find it. It's just like going to a good movie. You'll find all 12 synopses on one site. Why do you have to go and look at each one? You can go to one site. Gwinnett County should be the site where you can come and find all of this. So I'm going to turn this back over to Deborah.
We have a question, and then we'll wrap things up, go to the panel for final thoughts.
Yes, my name is Cynthia Romero. I'm actually from Florida. I just moved here, and I lost my son 2 years ago to a fentanyl overdose. And my question is are there any programs in the area to where we as parents of deceased children from that epidemic can go to get, counseling or something? Because I still haven't grieved from the loss of his death, and it's like, I don't really know how. It's hard. I have a hard time grieving from the loss of my son.
So I don't know of any programs. However, I did go through quite a bit of therapy, and I'd be glad to share, my therapist with you after this meeting, but I don't know of any programs for grieving parents.
There's an organization called Seek Life that offers free services, peer support, they do an individualized plan, and they can work with you. I can give you that information.
Seed Life, can we? Sea Life Inc. So we can get that. Sea Life Inc. through Viewpoint Health. Okay.
There's also Grief Share. It's not. Yeah. There's also Grief Share. It's not specific to opioids, so it's different deaths, but yeah, it's a good support system as well.
See what I'm talking about? Having one conduit where that question could be answered and the names could be given and push out. But yeah, I'm going to do that. Yeah.
All right, final thoughts from the panel. Words of wisdom. I would love to hear from Tasha. Your story has shaken Gwinnett. It has ripped our hearts open because it could be any one of us. Any final thoughts from Commissioner Watkins? Any final thoughts from the panelists? Any final thoughts from our subject matter experts?
I think the final thoughts are just get busy. Stay busy, take a little break and get your energy back, but there's work. There's lots of work to be done.
Just talking about more support, I think, for the families of victims of fentanyl overdose is something that I think needs to happen as well. We're doing prevention and treatment for those of us who are still with us, but we need to also give space for those who are grieving the loss of life, and just advocacy for everyone, decreasing, I'm going to say stigma needs to continue to be reduced, because this country historically has seen addiction and drugs in a way that prevents people to talk about it and bring it to the forefront to resolve it. So please, everyone, just talk about it more, and don't be afraid to talk about hard stuff. I mean, it's impactful. So that's what I would say.
And as you heard me earlier state, I've made a commitment to you. There will be a conduit, a one-stop shop where you can come and find out any and everything you need to know about substance and drug abuse. This whole program, this is just the start. Like I told you earlier, we're going from what the drug is, and then we're going to attack in September the behavioral aspect of why you start using drugs, and then transition into the recovery aspect of it. And after that, then I would have a full circle in order to establish, say, a county dashboard that even shows the success of some of the nonprofits and how they're dealing with this. Because I think if you're someone from the other state and you have a child or loved one that's an abuser, and you can go online and find, you know, how, just like in Yelp, how good is this group with helping people? I mean, there's nothing wrong with knowing how good someone does something and their recovery rate. And I think that will help in the overarching goal of this county to be the best place to come work, live, and play. And I'm committed to that and to this fight and this struggle.
It has been 4 years since I lost my daughter. And for the last 4 years, anytime I'm called upon, I will share her story. And I will continue to use my social media platforms as well to, you know, just remind the parents to talk to your children, your grandchildren, your nieces, nephews, just anything I can do to help spread awareness, bring awareness, please feel free to call on me. Also, I would like to really thank Deborah for reaching out and allowing me the opportunity to do this. And it makes me really proud to be a member of Gwinnett County. My daughter actually died in DeKalb County, and she was in the morgue for 12 hours. No one bothered contacting me, and they just didn't care. So I'm grateful just to live in a great county. So thank you guys, just so much.
I think Commissioner Watkins bringing us all together and everybody's involvement here kind of shows Gwinnett County does care. From the police department to all the different private entities, it's an amazing group that I think we have here. The health department is awesome about bringing us together for an overdose fatality review board where we dig into cases where a family member has died from an overdose, and we look at ways to try to find something to prevent that. Where you know, what was missing in that that person's life that could have possibly changed it. But you know, these families' stories are very powerful, I think. You know, to the kids that are out there, you sharing your story, I don't know how that can't be impactful to a lot of them out there. So I truly appreciate you, and I see a lot of other broken hearts out there, and you know, it affects me, and I think anybody else hears your guys' stories. I think it's very powerful, so I appreciate you guys sharing.
I'd like to say is that parents, watch your kids. Keep an eye on your kids. Talk to them, listen to them. If they start acting strange, like short trips to the stop sign, taking walks around the neighborhood. We know teenagers don't walk. They're out there doing something. And don't be afraid to ask.
And keep an eye on the phone. I always say to parents that I deal with, you know, growing up, it was like, you know, our parents smoked on planes. And I was like, how do you not know that that was not good, you know? And just seemed very, you know, yeah, that's not good. You can't do that. And I think that then we all found out that cigarettes are bad, and, you know, and I think that the phone is going to be our generation's cigarette. We just handed them over, and they can get anything on it. So whereas before, when I was growing up, your parents would say, hey, stay away from this area, stay away from that person. But now they take all of that to bed with them at night on a phone. And if we're not watching it, they're vulnerable. So, but thank you all for being here, and I'm so thankful that you brought this together. Thank you, Deb.
And thank you all. Again, conversation, conduits, exchanging numbers, exchanging contact information, networking. We have the resource tables out there, from Guide to Viewpoint Health to the DA's office to the Child Advocacy Center to GNR Health. Please take those materials to the medical examiner's office. Danielle Clark, is she still, Danielle? She has the latest data for deaths, so you can actually see it. And seeing it sometimes is believing it, hearing it. Let's not stop the conversation here. If you would like to sign up for any newsletters from Commissioner Watkins, head to GwinnettCounty.com. You can also find Fighting Fentanyl, the series, on our Facebook page, YouTube channel, Vimeo. Just search up Fighting Fentanyl, and it's a 4-part series. Thank you. Thank you. Let's not stop. And let me plug it. In September, Commissioner Watkins will be hosting a town hall around mental health. It's a crisis that's reaching epic proportions. As soon as we have those details, we're finalizing the plans now. We'll reach back out to you. So if you haven't signed up on that sign-up sheet where I was begging you all to sign up and eat some snacks, go ahead and sign up. And yes, still do eat those snacks. Thank you very much. God bless. Have a great morning.